Hi everyone. So what I've got to share in today's video is another footage of me taking my wheelchair out for a drive. Where I'm heading to is the dentist. I know that the footage is going to be a little bit bumpy. And if it's hard for you to watch, stay focused on me instead of the scenery driving. I'm going to be partly talking about dental health care when you're living with a chronic condition. And I'm also going to be talking about driving the power wheelchair during the winter months using bike lanes. I first want to focus on dental health care. Why this is important to me is to get the same message out that I've shared before. When you live with chronic pain, the medication that you're using for pain is targeting pain. It's not going to solely be focused in on where the source of the pain is, unless it's a gel or a cream that you apply to an arthritic joint, or an anti-inflammatory cream that you apply where it hurts. What you take orally, so what goes in your mouth, or medication by means of a suppository, meaning what's absorbed through your colon. It's like broadcast seeding in farming. It blocks out pain where pain's found, not limited to a specific hip, a specific knee, or some other area of your body like your back that's hurting. And this has come to bite me again. And what I mean is right here. I know you're not going to be able to see it on the camera, but right there, I've got an extremely serious cavity. And I've only felt a very light tinge. And it turns out that light tinge is that the cavity's almost all the way to the root of that tooth. I really can't underestimate or understate the value of pursuing dental care when you're living with chronic pain, and that message to your brain that says, oh, I know I need to go see a dentist because the tooth is hurting, is taken away from you. I want to flip this also on its head. This isn't just about going to the dentist. The dentist is maintenance, but it's you in day-to-day life that matters a lot. There are conditions like mine that affect the teeth, but setting that to the side, there are things that you can do that don't cost a lot and would save you money in terms of not as high of a dental bill. So I've been watching a vet series, and specifically there's been a lot of wild animals, tigers, other animals that are in the Kalahari Desert. The tall animals. I'm not talking about hamsters and small animals, but and meerkats, but the tall animals and lions as well. They use water to clean the teeth, and it's a very focused stream of water that gets off the tartar and cleans the teeth. So buying one of these pumps that you can use yourself at home, an Aquapick is what it's called, and that you can take your time, sort of 5 minutes a day, help remove the buildup, means that the cost of that unit to start with is going to be money that you don't end up paying to your dentist because you're doing part of what they would do for you. I also actually, while we're on the topic, was given a really practical tip today by the dentist. And that tip was about my use of electric toothbrush. So instead of it being like, side to side or up to down, they want me to go in a 45-degree angle and start the gum line. So right here, and then slowly go down and away so that you're teasing the plaque, the tartar, the minerals in the water, what gets in your saliva, and settles especially on the bottom teeth, that you're teasing it off the teeth and out of your mouth. So these are things that you can do that are essentially one-time expenses. Going and buying an electric toothbrush, going and buying an Aquapick. You don't have to spend tons and tons of money. And yes, I know what it means to not have a lot of money and where you're having to be very decisive about what you're doing. So I wanted to give you that information to think about it and consider if it's something that you could do to help yourself, where you're not powerless over not having gobs of money to make the best out of your one life. Now, in terms of the wheelchair driving, if you've got a problem where we're jostling, we're bouncing and getting juggled around and jostled around, it's going to cause you pain. You need to pay attention to how far you can travel before your body needs you to stop. And how much of a break do you need before you can travel the same distance to go back home again? And then you've got a rough ballpark where you could effectively take a map and just draw a circle, and that's going to be where you travel with your wheelchair unassisted. And if you're going outside that distance, then you use a paratransit vehicle, or where I live, the bus routes have a ramp that just falls out of the bus that your wheelchair just drives up on, that you could then use to go somewhere, and that becomes your new center. And then you have your new circle where you can drive. Then you get back to that bus stop and work your way back home again using the bus routes. What I want you to see is that the snowbanks are not religiously at the curb. So in the summer months, this is all clear, and it's a straight path in the bike lane where you're able to drive and you're not in vehicles' ways, and there's signs on the side of the street that are both no parking and marked as a bike route, and you're good to go, and you can enjoy it and you can be safe. For me, when I'm out riding, I avoid the sidewalks. It's like being on train tracks, and this up and down motion repeatedly causes a lot of pain in my knees, especially. But then if you're using the bike lanes during the winter, what I wanted to draw your attention to, and you really can't see it because the video is facing forward, you need to be doing shoulder checks and being aware of where traffic is, so you're not putting yourself in harm's way. Because really, it doesn't matter if the car's liable or not. If you get hit, no amount of money is going to put your body back to what it was before you were hit by a vehicle while dealing with a blocked bike lane. Now, the other part of this really is figuring out, and this is real equation, figuring out what you want to do with your life, what the cost of it is, and then what that sweet spot is. So what I mean by this is, if you want to get out of your home and that's what you want to do with your life, and the sweet spot might be I can handle maybe 30 minutes before my legs get really sore, then you really need to focus in on what you're going to do during that 30 minutes. Where I live, my home is just 5 minutes from the Bay of Quinte. I can get in my wheelchair and go down to the water's edge, and there's all kinds of trails there. It's absolutely wonderful to be down there. I love nature. There's opportunities for me to bring my camera down there, and you see, photo montage videos of what I take when I'm out. It's those quality of life enriching trips that are very valuable to me and that I really do enjoy undertaking. So I wanted to give you that to think about as well, because this really isn't just about, it's just not about getting your wheelchair out, but actually living your life, and that the wheelchair is a tool for you to be living your life and the best life that's available to you. So we just have maybe 3 or 4 more minutes before I arrive at the dentist's office in this particular clip. What I wanted to finish with is the appropriate attire. I've tried all kinds of things during the past decade of using a power wheelchair during the winter months. Sort of 44 Fahrenheit for me is where I can go out with a winter jacket and a sweater on, long sleeve shirt, jogging pants, socks, and my shoes, and I'm fine. Once we get below 44 Fahrenheit, then I'm needing to have what's called a lapgan. So that's a blanket that's 2/3 the size of a normal quilt, folded in half, and that covers my legs. And that's to keep me warm, sort of from belly button down. Because when you're sitting, that same blood flow doesn't happen that would naturally happen if you were out walking. So you cool down quicker. And then, sort of the colder we get, like when I make the winter photo montage video, I often will wear a t-shirt, long sleeve shirt, sweater, winter jacket, and then 2 pair of jogging pants, 2 pair of socks, and boots to keep my legs warm. Although I've now seen heating elements in gloves and socks or footwear that will help your extremities stay warm in the colder weather. And so there's options. But generally, that idea of having something flannel, blanket, even if maybe you bought a flannel sheet that's folded in quarters, like folded in half and then folded over top again, that would give your legs some protection. But bear in mind what you're eating so you're not putting on weight and your health is declining, sort of on a slow decline. I think that's what I had to talk about today. I'm glad you were here. Thank you for watching, and do your best to take care of yourselves. We've only got a few more weeks of winter to endure before we'll be getting into summer and the warmer weather where it's easier to get out. Thanks for the time you spent watching today. Bye for now.